this is destroying so much trust, especially in the United States, to have this program. And I guess it was probably about a few years that I really started coming to the conclusion that we were going to need to change something about that. COVID was the other big one, where that was also very tricky because, at the beginning it was, it's like a legitimate public health crisis, in the beginning, and it's even people who are like the most ardent First Amendment, defenders, the Supreme Court has this clear precedent that's like, all right, you can't yell fire in a crowded theater. There are times when, if there's an emergency, your ability to speak can temporarily be curtailed in order to get an emergency under control. So I was sympathetic to that at the beginning of COVID. It seemed like, okay, you have this virus. It seems like it's killing a lot of people. I don't know, we didn't know at the time how dangerous it was going to be. So at the beginning, it kind of seemed like, okay, we should give a little bit of deference to the government and the health authorities on how we should play this. But when it went from, 2 weeks to flatten the curve to, and like in the beginning, it was like, okay, there aren't enough masks. Masks aren't that important. To then it's like, oh no, you have to wear a mask. And, everything was shifting around. It just became very difficult to kind of follow.